give you some few important notes about what is the normal sinus rhythm. What do we mean by a normal sinus rhythm? A normal sinus, that it is the impulse is generated from the sinoatrial node. This is called a sinus rhythm. So what is the sinus? It is described as a positive P wave in lead 1, 2, and AVF, a negative P wave in AVR, and each P wave is followed by a QRS complex, and the distance between each P wave and the QRS is constant. What does that mean? It is a positive sinus, means arising from the sinus node, positive P waves in leads 1, 2, and AVF. It is negative in AVR. It's negative in AVR. Each P wave is followed by a QRS complex in all leads, and the PR interval is also constant in all leads and all PQRS complexes. This is the definition of the sinus rhythm. So what do we have here? We can notice, is it a sinus? Let's see. This is a positive P wave, positive P wave, positive P wave. But we can notice that the patient heart rate is tachycardic. So what's the heart rate here? The heart rate here, this is 300, this is 150. So we can tell that this patient is having a heart rate of about 130 to 140. Each P wave is followed by a QRS, and the PR interval is constant wherever you go. So this is called the sinus tachycardia, and it is regular. So this is an example of a regular sinus rhythm and regular sinus tachycardia. But in this example, definitely we can notice that the heart rate here is bradycardic. The patient is bradycardic, and we can notice that there is a small wave which is positive in lead 1, 2, and AVF. It is negative. It is negative in AVR. This is AVR. It's negative in AVR. Each P wave is followed by a QRS complex, and the PR interval is constant. So this is a sinus rhythm, and we can notice that it is regular, but the patient is bradycardic, and this is example of a regular sinus bradycardia. The patient still can be sinus, but it could be irregular. Let's have a look at this example. What happened here? Is it sinus? Yes, it's positive. It's positive 1, 2, and AVF positive P wave, negative in AVR. The PR interval is constant wherever you go. Okay, it is constant. The PR interval here is constant. The PR interval here is constant. But you can notice something, that it is irregular. So what happened? How can we notice that the distance, the RR here, the distance is different than the distance in the RR here? But we have to make sure, whenever you find this distance is difference, make sure that the P wave here before and after this change, it has the same morphology and has the same PR interval. What happened here actually is that this is called the sinus arrhythmia, where it is described as a beat-to-beat fluctuation in the resting heart rate caused by decrease in the heart rate. When the person takes a deep breath, there will be decrease in the vagal tone, and this will cause a drop in the heart rate. So that's why it's called beat-to-beat fluctuations in the resting heart rate caused by a decrease in the heart rate during inspiration. And the opposite happens during expiration. There will be a beat-to-beat fluctuations with increase in the heart rate during periods of expiration as the vagal tone will increase. But very important for you to notice is that the P wave morphology is the same during the cycle. So if we go back, I told you, we noticed that the P wave morphology is the same, and this is the example of the sinus arrhythmia, where the patient has took a deep inspiration here, so the heart rate has dropped during the inspiration, and then it increased with expiration. The heart rate started to increase, but the PR interval and the P wave morphology still they are constant and they are the same. This is the case of sinus arrhythmia. Let's have a look at this ECG. Is it sinus? It is positive here, and AVF 1, 2, and AVF negative in AVR. The PR interval here, it's constant, so let's take lead 2 as it has a long strip. It's constant with the same shape, constant with the same shape, but here no, there is a difference here. It is irregular, although it was sinus, but it became irregular. But the P wave morphology is different and the PR is different. So definitely this is not sinus arrhythmia, as the P wave morphology and the PR interval, they are not the same as the preceding wave. What has happened here is that there was an ectopic focus in the atria that generated a sudden unexpected impulse, and this is called the premature atrial contraction. This is a focus generated an unexpected atrial impulse, caused the atria to contract again prematurely. Thus, the P wave morphology here, as the axis will be different, although the axis it was here, so the P wave morphology it will be different than the sinus, and also the PR segment also distance will be, or length will be different. So a premature atrial contraction, in premature atrial contraction, the P wave morphology and the PR interval may be different from the preceding sinus P wave, while the QRS complex maintains its morphology. This is an example of different P wave. This is sinus. This is the sinus P wave. This is the sinus morphology. This is the sinus. This is sinus. But you can notice here that this P wave is different with the PR interval is different. This P wave is different, and even this P wave is different. This is another example. This is the sinus normal P wave, but this here it is a different in shape and morphology, causing the premature atrial contraction. Well, in this condition, what has happened?